Hello, my name is Caitlin Palachek and I'm with Cook County Health. Thank you for joining us. If you need help with an appointment or have a medical question, you can reach our health system at 312-864-0200. That's 312-864-0200. Our guest tonight is Dr. Terry Mason, Chief Operating Officer at Cook County Department of Public Health. Thanks for joining us.
I am so grateful to be here. Thank you for asking me.
Great. So with Christmas and winter around the corner, I wanted to chat about how people can stay healthy during the holidays.
Well, we've got a number of things that we can talk about, and the biggest thing is about food safety tips. And what we want to make certain is that people make sure they keep things clean, they separate things, particularly fresh poultry and other meats. Make sure they wash their hand, keep the surfaces clean. Make sure that, and I want to go back to that cross-contamination, because cross-contamination is a real problem. And we want to make certain that people are not cross-contaminating their meats. And we want to make certain that the surfaces are clean and that people wash their hands when they're preparing their meals. So it's a really important. And we want to keep raw meats separated from the cooked meats or the ready-to-eat meats or foods. So the other thing that's important, and this is not just for this time of the year, but it's also about making sure, even when you're doing things like picnics, of course no one is doing picnics in Chicago this time of year, but you want to make sure that your foods are cooked to the right internal temperatures. And that temperature is about 165 degrees. And if it's going to be kept cold, you need to keep it somewhere between just above freezing, somewhere about 35 to 40 degrees, to be certain that you're not promoting an environment for bacteria to grow. So it's very important. And there are other websites that you could go to, foodsafety.gov, where you can get more and more information about this. So it's really important that we get this out to the public. So and I'm so grateful that we've had this opportunity, having this opportunity to do this, because so many of the things that we do are about trying to prevent people from getting sick in the first place. So if we can avoid people getting sick by some very simple, easy to follow instructions, it's much better. So we want to make sure that people stay healthy. That's the real key.
And how do you do that?
Well, we want to make sure that we keep germs from spreading, and we want to make sure that people have as few of those germs that can spread very easily, like with coughs and sneezes and things of that nature. Because when you sneeze out, there's this real plume that comes out way much further than we ever think that it does. So that's important. So you want to cover your cough, usually coughing into your sleeve or you're sneezing. We want to make certain.
Do you cough into your hands? Because I know a lot of people still do that.
Well, you try not to, because if you're coughing to your hands, it just goes right through the fingers. It goes still coming out. So I always try to encourage people, if they have a long sleeve shirt on or blouse or top, that they cough into their elbow.
To their elbow?
Because it's much better. In addition to that, we want to make sure that we wash our hands. I mean, I can't tell you, hand washing is probably one of the most important things that we can do, and that's with soap and warm water. And you want to agitate, not just sprinkle it, rub, but agitate. And then when you're sick and you're coughing, you got to remember those flu particles, those virus particles are in the things that we're coughing out. So we want to make sure that we don't inadvertently contaminate our coworkers or our families and things of that nature. So you want to stay home when you're sick, particularly if you're running a fever.
Can we go back to the hand washing for a second?
Sure.
How long should you wash your hands for?
Well, I know most people don't have a stopwatch.
Right.
Okay. So usually I always make sure that I try and get at least 12 to 20 times that I've agitated the soap and the water once, and using warm water to make certain that that's.
Or by singing Happy Birthday twice, right?
If that works for you.
Yeah.
Have sing Happy Birthday twice. But you really want to get a lather, and you don't want the lather to wash off right away, because the soap helps lift the dirt particles and other particles off. So you want that there, and then you want to rinse with warm water.
And then when you're preparing food, when should you wash your hands?
You should wash your hands all the time. I wash my hands. When I touch something, I go wash my hands. If I'm preparing If I'm preparing meat or poultry or any of that sort of things, whenever I finish touching one, I go wash my hands. So you should, and that helps prevent cross-contamination.
And then you said staying home when you're sick.
And staying home when you're sick, yes. I mean, because I don't want to infect my coworkers.
Right. Me neither.
No, because then there are more people out sick, and then that ends up being more work for you anyway. So you don't want to contaminate people that have got to help you get the work done.
Can you talk about the importance of a flu shot? Have you gotten a flu shot?
Yes, our department gets a flu shot. Everyone in our department gets it. We're the public health department, so we always get a flu shot every year. We actually bring all of our employees together to make sure that we all get a flu shot. What people need to understand is that people say, well, I got the flu from the flu shot. Well, you really don't get the flu from the flu shot. You may get some reaction, but you don't get the flu from the flu shot because the virus that's there is dead. It's not necessarily a live virus. So what happens, though, people can't get reaction. And I don't say that they don't. They can't get a reaction. And it's important still that you take the flu shot because what we do, people say, well, we took the flu shot and I still got the flu or it didn't work. And last year, every year they try, the CDC takes their best guess as to what strain of the flu is going to be the circulating strain in the fall. And so they then make the vaccine because you can't wait till the fall to make the vaccine because you got to make millions of doses. So you take that best guess earlier in the year and then you start the manufacturing process for that particular strain. It's our best guess. Most of the times we're right, but occasionally we're not. And so there's a different strain of the flu that becomes active and circulating. And that's what happened last year. Why so many people got the flu even though they had a flu shot is because the strain of the flu that we vaccinated against was not a perfect match with the strain of the flu that actually was circulating. So that's why it's important that we get the flu. And even if it's not an exact match, it still may help what we call attenuate or make your response or make the flu that you do get less viral or less bad for you.
Yeah, I read that over 80,000 people died from the flu last year.
Flu kills people every year. Over 70,000 people die every year from the flu. So it's not to be taken lightly, and particularly those with any kind of underlying respiratory problems, asthma, things of that nature, the very young, the very old, we have to really be careful about that. And for the older ones, you hear people talking about pneumovax, which is a different bacteria that we try to inoculate the elderly with because we don't want the elderly getting this particular kind of flu because it could be not flu, but this particular kind of pneumonia with this particular bug because it can be pretty bad.
Right.
So that's why we do everything we can to make sure that we get those messages out. That's why you hear all the messaging going out all the time about get your flu shot, get your flu shot, get your flu shot.
When should you get it?
Well, I think you get it.
Can you get a flu shot in the summer?
No, you have to wait. Usually it doesn't come out till it's in September usually when the flu vaccine's available. So you get it when the flu's vaccine. Can't get it before the vaccine's available. So that's when we do that. And so by now, all of you should have had your flu shot.
I got my flu shot.
You sure?
Yeah, absolutely.
So we want everybody listening and everybody watching this program, if they haven't got their flu shot, make sure you go get it. It's paid for by most insurances. I mean, everybody can get a flu shot.
Where can you get it at, though?
Well, you can, and nowadays you can go and get it from most of the drugstores, Walgreens, CVS. You can get a flu shot there. You can get it from your doctor's office.
What if you don't have insurance?
Well, if you don't have insurance, there are some places, I don't know them right offhand where people can go, but there are some clinics. I know that we will, at the county, will give flu shots for people, but they have to come and register, and if they're unable to pay, we have a mechanism for being able to determine what they need to do so they can get the services that they need.
When does the flu peak? When do most people get the flu?
It'll be in another month or so.
Another month?
Yeah, another month or so. Yeah.
So after it peaks, can you still get a flu shot then? Is it still effective? Can you get a flu shot in March? Is there
I'm not
any
sure that
bad
I would
time
get
to get a flu shot?
I'm sorry. At that point in time, the season is getting close.
Right.
To it's not over yet, but it's getting close. So I would advise everyone to get their flu shot as early as possible because you still have to build immunity, and that takes time.
So between fall and January.
To get your shot?
Yeah,
Yeah,
it's the best time.
Yeah, I'd like to get it in the fall.
Right.
You know, we really try and get people to get it in the fall before the new year starts. So, you know, do yourself a favor, get it in the fall, and then you'll be okay.
Should parents vaccinate their children?
Yes. Parents should vaccinate their children. We know that children can get these problems, and again, if they have underlying problems like asthma or anything like that, anybody that has underlying respiratory problems, whether it's asthma or what we call chronic obstructive pulmonary disease, which comes from smoking, these are the things that can complicate a flu situation. So you don't want to create something where, or put yourself in a position where you are making your lungs work harder, that you're destroying your lung tissue like you do when you smoke cigarettes. So smoking cigarettes is a problem. You should not smoke because this destroys the passageways and the air sacs that are important. And these are the things that you need to have as many of them functioning as best as they can, especially if you get a flu.
Right. Thanks, that was informative.
Yes.
So how can you avoid gaining weight during the wintertime? And how can you keep the rest of your body healthy and feeling good?
Well, you know, gaining weight is, I always tell people, stop looking at a scale. Just try to eat better. And one of the things that we need to do is, weight gain is a simple formula. More calories in than burned equals additional weight. And there's certain foods that will put on more weight. And of course, we're going to see a lot of those foods over the holidays, starting with Thanksgiving all the way, I call it, for lack of a better term, we call it the season of gluttony. Starts on Thanksgiving Day and it goes all the way to
How
January 1st.
do you skip the apple pie?
You don't have to.
You don't?
You don't have to skip the apple pie. Just don't eat the whole pie. You know,
Okay.
a piece of the pie is okay. A reasonable piece of the pie is probably okay. If you're diabetic or have other problems that you need to be concerned about, you should check with your doctor about that. If you have other issues around food allergies or sensitivities, you want to be cognizant about that. But at the same time, and I want to really get rid of one myth. You cannot out-exercise a bad diet.
You can't?
You cannot out-exercise a bad diet. So you have to, exercise is important, but don't, you know how many people routinely go and get gym memberships in January? And many of them never
New Year's
go.
resolution.
Yeah, many of them never go. But you cannot think that you're just going to exercise all of that additional calorie and then continue to eat them.
Because abs are made in the kitchen, right?
The abs are made in the kitchen at the table.
Yeah.
At the kitchen table. So what we like to do is focus on less energy dense foods. So foods that contain fat, you got to remember, fat is 9 calories per gram. Protein is 4, carbohydrates are 4. So if you eat fatty foods, you're eating twice as many calories for the same weight of food as you would if you were eating a so-called protein or a carbohydrate. Now, what are the proteins? Everybody makes meat synonymous with protein. That's not true. The protein that's in the meat came from the food that the animal that we killed to get it ate. So the protein is in the vegetables. It's in the grass. It's in those things. And the amino acids that you need to string together to make proteins can all come from plants. I happen to be one who believes that a whole food plant-based way of eating is the best way to eat. And I do that because the meat contains heme, which is a molecule that can be very, very inflammatory. It comes from the blood, and the iron. All these things are very, very inflammatory. And then there's fat. So there's fat interwoven in between the meat. Some parts of the meats have more fat than other parts of the meat. But it's what we cook it in, and a lot of the gravies and a lot of things that we eat during that period of time. I don't put as much of it on the sweets as I do the fats. Because even the sweets, even sugar, is only 4 calories. per gram. The carbohydrate's only 4 calories per gram, but the fat is 9. So when you eat fat, that's much, much worse. Now, obviously, I don't say that people drink all the soda you want or all the beer and all the other stuff. No, I mean, you do these things. I don't even know if I can say moderation, because moderation means different things to different people. I remember once when I was a student, I was talking to one of the patients, and I asked him about drinking, and he says, well, we just drink in moderation. So then I said, well, tell me what that means. Well, 2 or 3 of us may get together and we may drink 3 or 4 fifths. And that's moderation for them. So, it means different things to different people. So we got to be sure that we talk about things in a way that people understand it. So I think that if we eat moderately, eat much more plants, because the plants will fill you up too. They take up space and they'll give you get a lot of benefits. You get the bulk, you get the fiber, and there's no fiber in any of the meat that you eat, none. So that helps us with elimination. That helps us with a number of things. And there's studies that show that, for example, women who have fewer than 3 bowel movements a week have a 5 times greater risk for breast cancer.
Oh, really?
Yes. Yes. So that's a wonderful public health fact to let people know that you can do something to modulate or to reduce your cancer risk by the things that you eat. And the same thing is true. The fat that comes out of animal-based products also is Dr. McDougall, one of my guys I know, he always says the fat you eat is the fat you wear.
Right.
So if you're eating, the fat is really where the problems are, and that's the cheese and the ice cream and all of those things, and the butter and all that stuff is that 9 calories per gram. That's where you got to really watch it for the time that we're coming up on.
So you're saying you don't agree with the keto diet?
No, I do not.
Do you agree with any of the fad diets?
No, I think that's what they are, just fads. Eat plants, eat predominantly plants, and you'll do just fine. I don't believe in any of those. They've all been shown not to do what they claim to do. The father of the ketogenic diet, or some of these things, was a guy who ran and died from a heart attack himself.
Right.
So no, it doesn't. You just need to. We know that the things in plants, the phytonutrients, the things that give plants their color, the fiber, all of those things help us to prevent damage to the inside lining of our arteries. I ask people, what's the number 1 cause of death? And they'll say a heart attack. And I say, well, is it? Is it really? It's really not a heart attack. They say, well, yeah, the blood vessels on your heart get blocked. But I said, well, what blocked the blood vessels? How did it get there? Well, it got there in the blood. Well, then how did it get in the blood to end up on the walls of the arteries? That came from the food we ate. So if we want to really do something, we need to change what we eat. And we could probably eliminate a lot of the misery that we have with the diseases. And so when you're overeating, that's even worse. So we don't want you to overeat. So eat, and eat until you're satisfied. Mm-hmm. But try to eat things. Try to have more plant-based stuff, more greens and beans and peas and potatoes. People talk about potatoes. No, potatoes are great. Sweet potatoes, regular potatoes, they're great. Root vegetables. No one ever got sick from eating root vegetables like potatoes or yams or beets or any of those kinds of things. It's when you load it up with sour cream and butter that you create a problem with it. And salt.
So a lot of things that happen during the wintertime is people start getting sad because there's less sunlight. Sure. You wake up, it's dark. You get home from work, it's dark. And then you could develop the winter blues or seasonal depression. What can you do to combat that?
Well, I think that if it really becomes a real problem for you, you should seek out medical professionals. Right. You should seek out psychiatrists, psychologists, sometimes group therapy. But the other thing that you should also do, this whole seasonal piece, we have to remember, for a lot of people, this is their first Christmas without their mom or their dad or their brother or their sister or their wife or their husband or their son or their daughter. And so a certain amount of that is normal. But when it gets to the point where you can't eat and you can't sleep and you can't do those things, you can't focus or concentrate, you really do need to see somebody. It doesn't need to necessarily mean you need to be medicated, but it does mean that you might want to think about getting some professional help.
Are there other things you can do? Exercise?
Exercise always helps increase your endorphins, so that always helps you feel better. Talk to people. You know, if you're bothered, don't withdraw. Talk to, have a friend that you can talk to, that you can share this with, that you can confide in, that will keep that in conversation between the two of you. And it's okay. Sometimes people need a hug. Sometimes people, and we can't be afraid to do that. I know in this time of everybody suing everybody for everything, it gets crazy. But I'm talking about your friend or your family
a good support
member.
system.
A good support system, yeah, and it's okay. It's okay to feel down every now and then. It's when you're down all the time that it's a problem.
What about those LED lights that you can buy that are supposed to radiate sunlight and release serotonin?
Well, I don't know about those.
Do you think those work?
I can't comment. I don't know. I'm going to say I don't know. But I do know that a supportive ear or someone who just listens helps a lot.
So exercise, a support system, getting enough sleep,
right,
and eating well.
And eating well. And eating most of and then avoiding your other things, alcohol and things of that nature. Obviously,
right.
If you're going to drink that, you got to be mindful that it's a drug.
Right.
Alcohol, we talk about a lot of drugs, but alcohol is probably the most dangerous drug we have.
I agree.
One of the most dangerous drugs.
Well, it looks like we are unfortunately out of time. Thank you.
It always goes so
I
fast.
know. We'll have to have you back.
Oh, anytime.
Thank you so much.
You are so welcome.
And thank you for everybody that tuned in. Hope you guys all have a great holiday season.